they were coating the allergen in the spawn, so they got a lot of exposure surface. So in this kind of allergen test in Taiwan, we have found the number 1 and number 2 allergen is the butterfly oil and the mustard, and then the number 3 is a German called Wang. And I believe this is the same because we were performing in 1992, and after 10 years, 2002 and 2012, we performed the same incident and also the ranking. We found the ranking always the same. So if your environment is investing a lot of hot spot, you will cause always define the same situation. And the other new development is using the so-called multiplex. Because previously, if you use an ELISA test, you can just test one allergen at a time. So they have a new way to test for total allergen-specific ID in the blood that can use a lot of allergen that hold it in one place. So some of the allergens, such as like using a new technique that is a microfreeze technique, that is the allergen have been coated in one small space, and when the blood goes through this place like this, and watch out using the automatic machine, and then they can perform all the ELISA tests in one chip. So this is called a new automation that costs very little time, and I use very little blood, and then maybe more than 20 to 40% of 14 items or allergen in one place. So they will try to avoid all these kind of menu and have done it in one chip. And then we found that they have more than 40 items in the chip can be performed, and we have a 10 test published in the pediatric allergen in urology. We found this kind of test was correlated with the skin-free test as well as to the immune test. So this is the so-called in vitro as well in vivo to do the allergen test. And then finally, we want to know is the patient really sensitive to this kind of allergen? So this is a publication test. However, one of the publication tests, such as you can use the nose to challenge and to find out if they have really got a bronchial contraction or the allergy symptom coming out. So this publication must be under a very good healthy condition. And then if you got any doubt, then you have to do it and to find out the patient really sensitive to this kind of allergy. So given the allergic conjunctivitis, you also can use a diluted allergen and then apply to the conjunctiva and then to find out if any allergic symptom come out. And then finally, this is the drug allergen drug publication test. You can directly use the oral challenge, inhalation challenge, or directly to the nasal challenge. So this is my final slide. I would want to emphasize that first thing is that clinical history is very important. But if you done the allergen-specific IG test, then somehow some of the results will not correlate to the clinical symptom because it just only shows that your immunology system are really sensitive to the allergen. So you have to do a next step and to have an organ that will really sensitive and respond to the allergen. And finally, for the allergen challenge test, that is 100% confirmed for you already have got this sensitization. But I think if you have a good, solid clinical history, you can already make a diagnosis. So this is my final slide. Firstly, you have to do the history, do a very solid clinical examination, skin-free test, the gold standard, but the reality is that you cannot do a lot of skin tests in one person, so you may test in the serum to test the specific IgE, and finally, if you got any doubt, do an allergen provocative test. And this is the final slide I will introduce. This is our author is Hugo Van Bieber. He have a book and very interesting book. And this, the title is the science, the teaching, and the successful story, and how to treat, how to prevent allergic disease in children. Thank you. Thank you very much.
Thank you very much.